This U.S. healthcare system project is about reducing household food insecurity and hunger by Asha Allen. The agenda is number 1, leading health indicator overview. Number 2, the SEM model. Number 3, comparison of national and state. Number 4, infographic. Number 5, policy overview. Number 6, policy impact. Number 7, person of influence. Number 8, conclusion. And number 9, references. Food insecurity is a growing problem where many households do not have reliable access to enough affordable, nutritious food. Families are struggling due to rising food prices, low wages, high living costs, and limited access to grocery stores, especially in areas known as food deserts. As a result, more individuals and families are depending on food assistance programs just to meet their basic needs. Food insecurity and lack of access to affordable, nutritious food are associated with a higher risk for chronic health conditions like diabetes, obesity, heart disease, and mental health. Food insecurity is defined as a household level economic and social condition of limited or uncertain access to adequate food. The current state of food insecurity and hunger is that in 2023, households with one or more adults with disabilities had higher group rate of food insecurity than households with no adults with disabilities. This issue affects people across the United States, including Ohio and local communities like Stark County. In the U.S., millions of households face food insecurity, and the rates are even higher for families with children. Here are some efforts to fix this problem. Food assistance programs like SNAP provide monthly funds for groceries. Gardens and local markets aim to increase access to fresh foods. Minimum wage increases, tax credits, job programs, and housing assistance are all meant to support financial stability. In the SEM module, you have the individual, interpersonal, organizational, community, and policy. In the individual level, individuals may skip meals, eat cheaper low-nutrient foods, or have poor diet quality, leading to malnutrition or nutrient deficiencies. In the organizational level, from a healthcare cost management lens, food insecurity often correlates with worse health outcomes and higher burdens for the system. For Stark County, this suggests that interventions focusing upstream could reduce downstream healthcare costs. On the interpersonal level, food deserts and access issues compound the problem. Even when some resources exist, geographic or transportation barriers may limit access to nutritious foods. At the policy level, policy and descriptive trends. Many nonprofits in Stark County are closely watching changes in federal assistance programs because they may worsen local conditions. Community level is communities with high food insecurity see higher healthcare use, hospitalizations, and long-term medical costs. Local clinics, hospitals, and public health systems become strained by preventable illnesses linked to poor nutrition. Here is a comparison of the state level and the national level. On the state level, in recent years, Ohio's overall food insecurity rate has been estimated at around 15.3% for households, a broad estimate. 1,391,290 people in Ohio are food insecure, and of them, about 386,430 are children. National 5.1% of U.S. households had very low food security, meaning household members' eating patterns were disrupted and food intake reduced because of lack of money or resources for food. In total, about 47.4 million people in the U.S. lived in food insecure households in 2023. Here's an infographic which shows a closer look at hunger close to home, understanding food insecurity. Food insecurity means not having consistent access to foods for a healthy life. And here we start on the game board at local. In Stark County, 14 to 15% of residents are food insecure. And then we move to what helps that. Well, community groups, churches, and food banks provide free, low-cost food. And then you move on to the state. In Ohio, roughly 1 in 6 and 7 households may experience food insecurity. And then we move on to what helps that is better income, employment supports, and improved food access. And then we move on to the national. 18 million U.S. households experienced food insecurities last year. What helps? Reducing hunger improves economic stability. And that's the finish of our game board. Then we move on to our policy overview. Here's a policy related to this issue. It is the House Bill 157, also called the Hunger-Free Campus Act. So, the relevance of this is the Ohio Hunger-Free Campus Act helps meet the physical, mental, and emotional health needs of college students by ensuring that all have regular access to nutritious food, which is essential for learning and healthy living. So the progress of this is House Bill 157 projects that small state grants will help colleges build or expand food pantries and emergency meal funds, connect students to SNAPs or food bank partners, improve students' health, focus, and chances to stay in school. How efficient is it? The policy uses a defined state funding amount to invest in campus-based food security interventions, with the intention that this investment will help colleges build or strengthen programs, reach food insecure students, and ultimately improve health and academic outcomes. How effective is this bill? The projected benefits of the House Bill 157 are realistic based on other states' experience. Expect tangible improvements in access and student well-being, while recognizing that continued investment is key to closing the gap. Policy impact. So this policy has affordability. The expenditure of $1.25 million over 2 years is intended to leverage existing infrastructure at colleges, universities, and encourage expansion and improvement of student food security programs. This policy is also feasible. The idea is that the relatively modest state investment will act as an incentive for campuses to build sustainable programs and thereby reduce food insecurity, improve student well-being, retention, and success, thus maximizing the bang for the buck. This policy has acceptability. The Ohio Hunger-Free Campus Act is widely viewed as an acceptable and positive policy by lawmakers, college officials, and community organizations. However, there are consequences. One major positive outcome is that the bill would likely help reduce food insecurity among college students. The only negative consequence is it may take a while to raise those funds. Here is our person of influence, Representative Sean P. Brennan. He sponsored the Hunger-Free Campus Act. He helped introduce a sponsor a bipartisan bill and help at aiming college students who face food insecurity. He worked to create grants for campus food pantries. and support services. This would allow colleges to receive grants and establish these food pantries, emergency meal credits, or meal plan, donation programs, partner with local food banks, all of these wonderful things that would help put the Hunger Free Campus Act bill in motion. Also, he has public advocacy and he raises awareness in the media. He has emphasized that many college students struggle to get enough food, affecting their mental health, academic success, and overall well being. And he argued for state support to address this hidden hunger crisis. So, the Hunger Free Campus Act recognizes that food insecurity isn't just a problem for children or families, but also affects many college students who may be working, supporting children, or living on tight budgets. By targeting higher education institutions, Brennan is helping a population often overlooked in anti hunger policies. This legislation can also reduce stigma by offering food assistance directly on campus. And making it easier for students to get the help without the shame and the paperwork. It also connects them to federal nutritious programs and local food banks, creating a broader safety net. By investing state resources, the bill shows a commitment from government rather than expecting charity alone, framing food security as a public responsibility, not a personal problem. In conclusion, if society does not act, food insecurity will continue to harm families, strain public resources, deepen health and educational gaps, and limit future opportunities for children and communities. Addressing this issue now is essential to protect public health, support child development, and build stronger, healthier, and more stable communities for the future. Thank you.